One of the things reasons I came here is I actually know two people who had it here first at ALO Bariatrics, both in Tijuana. And they both had such great experiences, told me about it, that I decided to come here. And one of the things that I find that made it so easy is the fact that you fly into San Diego, they pick you up, they bring you directly to the facility, and when everything's over, they bring you back to the airport. So you don't have to figure your way out, figure your way around, or have any directions, especially for someone like me who's had this when I was 60 years old and came by myself. So they just made it very easy. Having said that, when I got here this time, I did walk around Tijuana. There's a Starbucks right around the corner. And I felt very comfortable, and nobody in this city has been anything but very, very pleasant to me. So I'm very comfortable here. At my age, being 60, I've obviously had several things happen during my life, and I've been in hospitals in the United States before. The care given, the aftercare given here, immediately out of surgery in the emergency room or recovery room, was excellent. The girls were always there, checking on you, offering you ice chips, making sure you had your medication, cleaning any drains or any wounds that they needed to clean. It was just as good quality as I received in the United States. My sister and her friend both had the surgery here, and they're the ones that told me about it. They've additionally known several other people that had it, and all of them, by the way, had had it at ALO Bariatrics in Tijuana. Without exception, they had wonderful experiences. So I checked it out a little bit myself, and 2 months after my sister had her surgery, I booked mine. It's a very simple process. They walk you through the whole thing, and once you contact them, they walk you through the entire thing and answer any questions you have, whether it's regarding funds, before surgery care, after surgery care, clothing that you'll need, or whatever. I can't imagine that any company in the United States would have gone that far and done any better than the people here did. The level of self-confidence that went at losing that weight was amazing, just amazing. And it started happening right away when I just started losing 5, 10, 15 pounds that I just haven't been able to lose for 20 years. Additionally, one of the reasons I decided to have it when I did at 60 is because I knew that that weight was really going to start affecting my health at that age. And I was on high blood pressure medication and thyroid medication. Since the surgery, I'm off the blood pressure medication, and I take the very lowest dose of thyroid medication that's available, and I have no other health problems. Small things like, since I'm getting older, pains in my knees or in my feet when I would stand or walk for a long time, well, that's gone. It's just gone. My skin's gotten better. Health-wise, it was the best thing I ever did for myself. I joined a couple of those bariatric websites, you know, for information that you do on Facebook, and there's a couple of different sites that only people with bariatric surgery can join. And I heard so many complaints from so many people about the pain, and most of these were women in their mid-30s. I personally, it wasn't even a big problem for me, but I must stress I followed every rule they told me, everything. I was nervous about it because of my age, so when it comes to the before care and after care and what you can eat and what you can drink and when you can introduce different foods, I followed it to the letter. And I didn't have any problems at all, absolutely none, to this day. A couple of times I'd have a problem, it's always when I ate too fast, you know, or something like that. But if you follow the rules when it comes to walking, drinking, eating, taking the vitamins that they recommend, again, I'm 60 years old and I have not had any problems with the surgery at all. All positive, all positive. And any questions that I had after the fact, 2-3 months, if I emailed the facility, were always available to answer any questions I had. So, pain and all that, I can't complain too much because I really didn't have that big a problem. We moved a little bit slower for a few days, had to be a little careful rolling over in bed and a little careful standing up. But I think the big thing here is I had the surgery last year, I had it on a Thursday, and I was at work on Tuesday and had no problems. All I had to do was make sure I ate when I was supposed to, drank when I was supposed to, and got up about every hour to walk for 3 or 4 or 5 minutes to follow that walking routine. So I didn't even really miss any work for it.